As healthcare costs go up, fewer employers can afford to provide health insurance for their employees. This is why in Butler County, at least 11,000 people have no health insurance. Our Butler neighbors have fallen through the cracks in the healthcare system. Because they're working, often at 2 jobs, they do not qualify for medical assistance and other welfare programs, but they have no health care benefits and cannot afford private insurance or medical care. Often their medical care is the emergency department, with crises that could have been avoided with primary care, treatment, and follow-up. These are the patients of the Community Health Clinic of Butler County. They are Butler County residents aged 19 to 64 with incomes no greater than 200% of poverty level. They are not eligible for any other primary health services. For these patients, we provide primary health care and medications at no cost. Most of them have not seen a doctor for years. Many cannot afford the medicine they need to keep them well and functioning.
I heard through a friend of mine who I work with, and she had signed up for it, so I thought, well, I'll try and see. Maybe my income's too much, but it wasn't, and I've really enjoyed it. I think it's a great opportunity for people that can't afford insurance.
Most of our patients suffer from long-standing chronic illnesses that can be controlled with primary care and follow-up: diabetes, high blood pressure, arthritis, asthma, and others. The clinic is like an old-fashioned family doctor. We keep track of our patients, check on their progress and their medications. Each new patient receives a thorough physical exam.
It's a state-of-the-art clinic. We started from beneath the ground up. We had to break up concrete floors and put in drainage lines, and everything's brand new. It's a terrific place to volunteer, and it's a terrific place for patients to come for care.
Thanks to the financial support from Butler Health System, companies, civic organizations, churches, foundations, individuals in our community, and many contractors and suppliers who contributed labor and materials, we opened our doors to patients in 2008. Many people eligible for clinic services do not know of other services available to them. Our case manager refers them to the appropriate agencies and helps them with the applications.
Respect is the number one criteria. I mean, they've always been very kind to me, and I really appreciate their thoughtfulness and kindness.
Next year, we are looking at, the Community Health Clinic is looking at adding dental to our services here at the clinic. And there is a huge need for dental here as well. We have over 700 people who have responded to that. They're aware that we do have those services coming up next year, and they've called in and they're inquiring about those services here. So we already have a waiting list of over 700 people in need of those services.
I think that Community Health Center means so much to people in the community because they know that there's a place they can come, get medical care, get their medicines, and they're taken care of by so many caring, compassionate people.
We are a volunteers in medical clinic. Volunteer physicians, dentists, nurse practitioners, nurses, and dedicated community people provide the wide variety of skills necessary for our successful operation. In addition, we have a network of specialist physicians who have agreed to see referred patients in their offices when necessary. Some community volunteers help screen patients for eligibility. Some greet patients when they come in and guide them through the process. Some are receptionists. Others help with data entry and other important office functions.
The volunteer needs of the clinic are very wide-ranging. That was one of the things that attracted me to this opportunity. When my wife and I were initially discussing it, she had a list that showed the various kinds of work that needed to be done here, and it runs the gamut. It's like any other organization. You need pretty much from clerical to technical to administrative, the whole nuts and bolts of running an organization. So there's an opportunity for anybody with virtually any skill set to volunteer here.
Some help with the important and time-consuming task of filling out applications for low-cost medicines from pharmaceutical companies that help us maintain our in-house pharmacy. We provide most medications at no cost to the patient.
I take 2 medications, and they made application to the different drug companies, and I get my medication for free through these drug companies and through the clinic. All I did was tell them what I was taking, and they did the paperwork. I brought down my information to prove that I was eligible, and they've taken care of everything from there.
All of our volunteers commit to the clinic's philosophy that patients shall be treated with dignity, compassion, and respect in a warm and friendly environment. Our goal is to provide the care and medications needed to keep people healthy and able to work and care for their families.
When I first started coming to the clinic, I had went years with an irritation rash, and nobody knew what to do. I came here after two sessions of talking with 2 different the doctors here. They figured out what it was, and now I am much better. They have helped me tremendously.
This health clinic has been a lifesaver for me, more ways than one.
Our waiting list of patients testifies to the need. It costs us between $600 and $1,000 a year to treat each patient. We can only continue to meet this need with a constant flow of volunteers and money. We ask you to help us provide this care for our patients. If you can give donations of money and/or time, please call the clinic. In addition, our web page has information on volunteer opportunities. Our patients are our neighbors. When we care for them, we care for our Butler community.